Thank you for joining us this evening for a discussion about adolescence and mental health. My name is Hema Patel, and I am the mother of a 30-year-old son who lives with cystic fibrosis. He was diagnosed at the age of 14. His father and I had just got divorced. A diagnosis and a divorce were very difficult for him. He went through rebel years, and at times he really took it out on us. He didn't always engage in daily care activities like airway clearance, and certainly didn't want to be a part of the CF community. We felt isolated after the move here from the UK, and then even more so when he was diagnosed. I thought there were no people with CF anywhere. And I also believed that there was no one in my own Asian community who experienced CF. So I have experienced firsthand the feeling of isolation and being unsure of how to help my child, which is why I'm so pleased to be part of tonight's discussion. In a few minutes, I'll introduce a panel of experts who will help you understand your child, offer practical information and strategies to help support them, and most importantly, remind you that you're not alone in this. But first, a few logistical items. For the chat, you'll want to change the drop-down menu so that your messages go to all panelists and attendees. That way, everyone can see your comments. Thanks in advance to our chat moderator, Mary Beth Pryor. If you're finding the chat distracting, you can close it by clicking on the chat icon at the bottom of the screen. We will address questions you submitted during registration, and we'll also take some of your questions live. Please type your questions, which you can submit anonymously by clicking the Send Anonymously box at any time in the QA box. Our panelists won't be able to address individual situations or provide medical advice, so please try to phrase your question in a way that would be more broadly applicable. If we're not able to get to every question, we will do our best to follow up. Closed captioning is available, and it should be showing automatically at the bottom of your screen. You can hide these subtitles or adjust the view by clicking the CC icon at the bottom of your screen. If you have any technology problems, please return to the event homepage and click the live support chat icon in the bottom left of the webpage to connect with tech and program support. Finally, this event is also being recorded and will be posted on YouTube. So everyone watching tonight will receive an email with a link to that recording and other resources. But before we invite our panelists on, let's turn it over to Sue Sullivan, Senior Director, Head of Community Partnerships with the Cystic Fibrosis Foundation. Sue's here to welcome us. Welcome, Sue.
Thank you so much, Hema, and thanks for sharing your personal story. Thank you to each of our attendants participating at home tonight. Mental health can certainly be an uncomfortable topic to talk about, but it's a critical component to overall health and wellness and should be given the same attention that we would give to any other symptom. I really applaud each of you for being proactive in supporting your family tonight and as you move through this extremely challenging time. This last year has unquestionably tested our resilience in many new ways, and we continue to be more and more hopeful, though, that things are in fact improving. Based on current data about COVID-19 and cystic fibrosis, we know that infection rates continue to be low, half of that of the general population, and that people with CF, especially our younger people who don't have advanced disease, are faring well overall physically. We know that the CF community took great care to avoid exposure to COVID-19. And that isolation, though, and uncertainty has certainly taken its toll. We also know that the pandemic left many people without their usual coping mechanisms or sources of joy. And some individuals in our community experienced deep loss. It's no surprise then that many people are experiencing depression or anxiety. This is true for people in every age bracket and walk of life. More than 42% of people surveyed by the US Census Bureau in December reported symptoms of anxiety or depression, an increase from 11% in 2019. Although we're analyzing the data due to COVID-19, current data from the 2020 cystic fibrosis patient registry strongly suggests that people with cystic fibrosis also experienced higher rates of anxiety and depression. We also know that some individuals face challenges related to their race and identity that can further impact mental health. For example, Black and Hispanic people reported higher rates of depression and anxiety than their white counterparts. And in 2020, and gender diverse people reported higher rates of anxiety and depression compared to their cisgendered individuals. If this is true for yourself or your child, you're not alone in feeling this way. And you're also not alone in the struggle. Your care teams, me and my colleagues at the Cystic Fibrosis Foundation, and countless people in this strong CF community are here to support you. Tonight, our panelists are going to share information and resources to help you feel more confident and connected as you continue to navigate this new parenting journey. Whether you have specific concerns or just really feeling unsure of how to support your adolescent during this time, that's what tonight's event is all about. We're going to walk through some strategies to help your child cope with sadness and the loss of the pandemic and offer some practical suggestions to help prepare you to better support your child through the transitions that still lie ahead. I want to say a special thanks to the Cystic Fibrosis Foundation's Mental Health Advisory Committee for their tireless work on behalf of the entire CF community. This group of experts is committed to improving mental health care and outcomes for all people with CF, as well as their loved ones. And they're behind many of the resources that we will share with you tonight. I also want to make sure that everyone is aware that tonight's conversation may involve moments of very heightened vulnerability and include frank discussions around topics such as anxiety, depression, and suicidal thoughts. Our panelists can't speak to individual circumstances or give medical advice. If you or your child is in crisis, please contact your care teams or call the National Suicide Prevention Lifeline at 1-800-273-TALK, or you can text HELLO, HELLO, to 741741. Finally, I want to acknowledge all that you have done as parents and caregivers on the call to take great care of your children during this insane time that we're all living through. As you take care of your child, please also be sure to take care of yourselves and reach out for help if you need it. We're here to connect you to the resources, even if you don't know where to start. And now, Hema, it's my pleasure to pass the microphone back to you to start this very important topic and conversation. Thank you.
Thank you so much, Sue, for the introduction and for arranging this evening's discussion. I'm sure it will be helpful for all of us. Now I'd like to introduce our panelists, who we are so grateful to have with us tonight. Please welcome Adrienne Alpern, pediatric psychologist and CF mental health coordinator at the Children's Hospital of Orange County, Eric Schleich, mental health coordinator at the Johns Hopkins All Children's Hospital CF Care Center, and Olivia Davis, an adult with CF. Welcome, panelists. Olivia, I'd like to start by hearing more about your story.
Thanks, Hema. Hello, everyone. I'm Olivia. I'm 26 years old and I'm from Berkeley, California in the Bay Area. And I'm here just because I want to share my personal experience living with cystic fibrosis and how it's affected my mental health over the years. So a little bit of background to start. I was diagnosed when I was 17 months old, and for most of my childhood and early adolescence, I was relatively healthy. I would go to the hospital once a year for my 2-week tune-up, as we like to call it, and I would do my treatments and had many doctor's appointments. But other than those things, I had a relatively normal childhood and was able to maintain a healthy social life and things like that. But my mom was really a key person in helping me stay resilient through all the ups and downs of having cystic fibrosis. She would stay with me during every hospitalization that I had. And she would do all kinds of things to kind of help make the stays a little easier on me. And one thing that in particular stands out as an adult now, looking back, is a practice that she started with me, and we did it every year. She would bring a large piece of paper and stick it up on the wall in my hospital room. And she would help me make a pro and con list about being in the hospital. And this was such a simple but effective little routine that we created. And it gave me space to express emotions about what I didn't like and what was sad and frustrating about being in the hospital, but also opened me up to the fact that maybe there were some positive things about being in the hospital, like seeing the nurses that I loved and getting visitors and being able to play hooky from school for 2 weeks. Not to mention getting that special time one-on-one with my mom, which I always looked forward to. So that's just one example of something that my mom did that I think really helped shape my perspective and resilience going forward in my relationship with CF. So as time went on, I graduated high school and I went to college at UC Santa Barbara. But during my second year, my health began to decline very rapidly. And I ended up having to leave school in the middle of my second year. My PFTs were dropping. I had a lot more frequent hospitalizations and infections. And this was about the time that my mental health really I began to struggle with my mental health a lot. And I think, it was because I wasn't able to do the things I liked to do, and I didn't have energy. And, I was just coping with symptoms that I had never experienced before. So, and another big thing was that I was scared for my future, which is, I think, something that a lot of people with CF experience. And so it was during this time that I started seeing a therapist, and from encouragement by my parents, I started seeing a therapist regularly. And that was a big part of what kept me stable and doing okay during this time. And so, unfortunately, my health continued to decline. And in 2019, I was evaluated for a double lung transplant. That was a really intense time for me emotionally. I was really scared, did not want to do a lung transplant, obviously. And it was around this time that my therapist suggested that I try taking an antidepressant. And at first, I was very against the idea. I was not comfortable with it. I thought that by taking an antidepressant, I would be admitting to failure, that I had somehow not lived up to, all of the lessons that my mom taught me growing up, or that I wasn't strong enough to deal with CF anymore. And something that my therapist said to me that really stood out was, you take medicine for every other organ in your body, basically. Why is your brain any different? It's a part of your body that's struggling and is needing some help. And there is a medicine that can help you. So why wouldn't you take it? And that really encouraged me. And I did end up taking the antidepressant. It did have a positive effect. I started just being able to go about my day-to-day life easier without feeling really, really down. And my CF team was kept in the loop of this, and they were supportive and interested in my emotional wellness, which was comforting to me as well. And so luckily, in the winter of 2019, I was able to start Trikafta, which significantly improved just my overall health and the quality of my life. I had more energy. I was able to sing and go for hikes and do all these things that I love to do. And because of that, my mental health also really improved. And so currently I'm starting to have conversations with my therapist about potentially reducing my dose, or maybe even going off of my dose altogether. Although right now, because we're living through a pandemic, I'm not as keen to start that process. anyway, that's just a bit about what I've been through and what my journey has been like. And I'm really happy to be here and happy to answer any of your questions later on in the Q&A.
Olivia, thank you so much for sharing your story. Sounds like your mom and you were able to find some creative ways to navigate through your own mental health issues. So
Absolutely. Always grateful for my mom.
very nice. Okay, now Adrian, we'd love to turn to you to hear about the adolescent experience and some of the dynamics and transitions that impact emotional wellness during this time.
Thank you so much, Hema, and thank you, Olivia and Hema, for sharing your experiences. It is so important to hear directly from people living with CF and their families. So shifting gears, let's talk about teenagers more broadly. We know that as part of typical development, adolescents are in the process of defining themselves and their identities. They are taking steps to build independence. They spend more time with friends and less time with family as they age, and they experience a range of emotions just like everybody else. And the pandemic has completely disrupted this process where teenagers are not being allowed to do the things that teenagers ordinarily do, which is develop independence, spend more time with friends. So even outside of the pandemic, emotions are part of regular life. Everybody has ups and downs. Everybody has good days and bad days. So I'd like to touch on how to tell the difference between emotions that come and go as part of daily life, as opposed to longer lasting emotions that suggest depression or anxiety that would benefit from treatment. So sadness can last a few hours or even most of the day for a few days if somebody's experienced a loss or got bad news. But it generally has a minimal impact on that person's life. On the other hand, depression is more persistent, and depression gets in the way of life in some way, even if it's just a little bit. So depression may interfere with the person's activities or ability to do well in school, or their ability to feel close to friends or family, or their ability to have fun. Depression also comes with a handful of other symptoms. So the person may lose interest in their typical activities. They may experience changes in sleep or appetite, poor concentration. They may experience fatigue or thoughts that they're no good or that they've disappointed themselves or others. Something really important to know, though, is that many of these symptoms have to last most of the day, more days than not, for 2 whole weeks to be considered depression. And that's to account for the fact that everybody has ups and downs. Everybody has good days and bad days. It's also really important to know that depression can be an appropriate response to a stressor or loss, like learning that your health has gotten worse. And even when depression is very appropriate, it can still be treated by a mental health professional. As a parent, the really, really good news is that it is not your job to diagnose. It's just your job to be aware of your child's typical mood and behaviors so that you can notice a change. So that was a bit about depression. Touching on anxiety, the difference between fleeting worries and an anxiety disorder is really just that an anxiety disorder lasts longer, gets worse over time, and tends to get in the way of life in some way because usually the person is avoiding the thing that they're very nervous about. So I'm happy to touch more on that in the Q&A, but wanted to shift to how do you support a teenager who's experiencing some fleeting emotions when there aren't other signs of depression or anxiety? So the first thing to really know is that there's not one right way to cope. You get to figure out what works for you as a caregiver of someone with CF, and your child gets to figure out what works for them. And their preferences might be different from yours. They don't have to cope in the way that you cope. They get to figure out their own way. So I'd like to point out some general strategies to consider, but obviously keep in mind that you get to choose these strategies or not based on your own values and your own priorities. A good first option is to really make it okay in your family to talk about feelings and challenges. Make it okay to not always be okay. Olivia's mom did that during her hospital admissions by making it okay to talk about the cons and the hard things about being in the hospital. So in terms of incorporating this into daily life, you can have family members who want to share a high point from their day and a low point from their day every day during dinner. And if your teenager doesn't want to share a high point and a low point, that's okay. You can share your high point and your low point just to show them that it's okay to talk about these ups and downs. A good second option is to help your child develop a self-care routine with a few things that he or she prioritizes. So some people, as part of self-care, prioritize getting enough sleep or connecting with other people or exercise. Some people prioritize spending time outside every day, even for 10 minutes can make a big difference. And some people prioritize other meaningful activities. The important thing is not for your child to prioritize sleep or prioritize exercise, but to choose a few things that they want to try and that work for them, and to do those things really consistently. So you can help your child think through their options and make a plan to try something out for a week or two. Another important consideration is, how do you respond if your child does come to you with sadness or worry? And the first thing to keep in mind is just resist the urge to cheer them up. It is so natural and so normal as a parent to want to protect your child from uncomfortable feelings. But at the same time, trying to cheer someone up without hearing them out can really make them feel worse. Teenagers can feel like they shouldn't be feeling that way. Something's wrong with them for feeling that way, or like they're disappointing you for having a feeling. So instead, if your child comes to you with sadness or worry, just listen, repeat back what they're saying so they know that you're listening. And then a great strategy for teenagers is just ask them, would you like me to listen? Would you like me to cheer you up? Or would you like me to help you brainstorm ideas about what to do? And then your teenager gets to set the tone and take the lead on what they're looking for from the conversation. Last but not least, you as a caregiver are so important. So please take care of yourself. You are a role model for your child in terms of how to cope with challenging feelings. And so please take care of yourself in whatever way works for you. And you can do that. That way you can have a little more time and energy to also take care of your teenager. Last but not least, I'd like to shift gears to talking about supporting a child who is showing signs of depression and anxiety. And the main thing to know here is just that those are treatable conditions that require professional intervention. They don't have to be incapacitating to benefit from intervention. So go ahead and just find a good time to talk to your child, point out the specific behaviors that you see, like, I noticed you're spending more time alone, sleeping more, and texting with your friends less. You don't have to make inferences or judgments or diagnose. You don't have to say, I think you're depressed. Just point out the specific behaviors you see. Ask if they've thought about therapy. You can offer any anecdotes that you have about yourself, your family members, or others who have benefited from therapy. And then talk to your child about therapy as a tool where they get to team up with a neutral person who doesn't have some agenda for them, but will just team up with them to bring out their strengths, help them set goals, help them navigate challenges. And I'm happy to speak more about how to talk to teens about therapy and what to do if your child resists in the Q&A. But the bottom line is just emotions are part of life, but if they get in the way of life or keep your child from enjoying things, it's time to consider teaming up with a professional. And now I'll hand it back to Hema.
Thanks, Adrienne. That was a great overview of what families should know. As a parent, I remember feeling like I wanted to help fix things for my son, but resisting that urge usually led to better outcomes. So, you know, I wish I had you in my life to give me those tips back then. But thank you for all of that. Eric, can you tell us more about how CF might play a role in what people are experiencing right now?
Yes. Thank you so much, Hema, and all the panelists speaking tonight. I'm here to talk a little bit about how CF can affect adolescents just by having CF. Teens, as we learned before, are generally concerned with how peers perceive them. They want to be accepted. They want to look good. They want to be recognized for their abilities. And that's for all teens, but sometimes teens with CF can have a heightened awareness of some of these because CF may present concerns with body image. As we know, sometimes physically people with CF can appear smaller. They can reach maturity a little bit later. Sometimes there's concerns about coughing in public or having to stop and take pills in public. If they're needing to give up activities to go home and do treatments or eat extra calories. So there are some things that teens with CF may be much more in tune with that could cause some issues as far as them belonging or being accepted. They may have conflicting feelings about missing school or activities with peers due to medical appointments or hospitalizations, leaving class to have to take their medications, leaving school early for doctor's appointments, or generally just missing some milestone activities. Challenges with friendships or dating relationships. Can I really trust to disclose that I have CF to somebody I'm getting close to? Maybe I've had a positive or a negative experience with that. And depending on that, that might be something that they're maybe holding back on, which might limit their closeness of their friendships. Also the awareness of a potentially limited lifespan. Who can the teen talk to about that, if anyone? Keeping it inside can certainly be a burden, but also it can increase isolation because talks about limited lifespan or death is something that we avoid as a culture. Well-meaning adults might want to help eliminate some of these feelings of being different by saying, you know, you're just like everyone else, or think about all the good things you can do. And while that's helpful, it is important to say, you know, CF does make you different, but different doesn't mean bad. If we just go ahead and glaze over that fact, then that can make kids feel like, well, they don't really get it or they don't want to talk about it. But I also want to acknowledge that there are some positive impacts of growing up with a chronic health condition, especially CF, and that there can be increased maturity, increased resilience, and really making the most out of life. If a person is thinking that their lifespan is limited, really making the most out of their time here. As far as during the pandemic, you know, with experience, the calls that I made to families while we were on quarantine is I was really surprised at the resilience of the families with CF. Most families already had mastered infection prevention and control and were confident in their coping mechanisms. The pandemic also leveled the playing field for some kids and teens with CF as they were in the same boat with some other people who had to, you know, for the first time, they were needing to wear masks or wash their hands or carry hand sanitizer, as pretty much everyone in the world was doing. Everybody was missing school, everybody was missing socialization opportunities, milestones, graduation. So that helped them feel less isolated. Pandemic fatigue definitely began to set in and was much more present when the new school year did not start in person. Many faced low motivation and felt as if school didn't matter. What I wanted to introduce was the topic of grief. And grief is not just a word that we use when somebody's lost a loved one or somebody has died. Many people have been grieving but didn't know it, but I would encourage you to name it, to tame it, and call this last year a big grief experience. We have had many, many losses this past year. And as a culture, we like to compare losses, but really your loss is the worst for you. It doesn't matter if somebody else has it worse. Kids have lost so much over this last year: safety, connection, major milestones such as prom, graduation, and class trips. These are big deals in the life of a teen. I want to remind parents that teens, their brain development is a little different than ours. And developmentally, they cannot see, they're not as future-oriented thinking as we are. So their hopelessness really does feel that way to them, like this will be the way it always is. We're always going to be in a pandemic. I'm never going to go to school again. You might want to say to the child, oh, that's not true. Everything's going to come to an end. It'll be fine. But it really would get you farther if you just validate that their experiences are that way. And talking about the mental health piece in the clinics is that you should have at the very least a mental health coordinator or social worker that can give you a brief mental health screening and referral. If you don't have one, you would just mention that to your pulmonologist and they can get you hooked up with a mental health coordinator or somebody in the community that can give a better assessment. Typically, pulmonologists are not going to address mental health with medications, but some do. But we just want you to know that mental health is a part of the CF Foundation's drive for care. And if If you don't have a mental health coordinator, please reach out to your social worker in the clinic.
Okay. Thank you so much for answering those important questions, Eric. The pandemic has definitely tested our endurance, and so many young adults with CF have had their own set of challenges. Thank you so much, Eric, for sharing your knowledge on this subject. And now I'd like to invite all of our panelists back to start our audience QA session. Hi, Olivia. Hi, Adrian. Our first question is, if I think my child is struggling, how should I bring it up? And this one would be addressed to Olivia.
Hi there. So I think just from my experience, the way as a teen, I think I was most receptive to conversations with my parents about, any troubling things that were happening in my life was when my parents would just lead with open-ended questions, lead with curiosity. I think Adrian was mentioning earlier, reminding parents that it's not their job to diagnose or say that they think something is wrong, but really ask, because at the end of the day, you don't know what's going on in someone's head. So I think knowing that my parents were genuinely curious and wanted to know and wanted to support me encouraged me to open up, and also for me to not be fearful of any judgment on their part.
Yeah, that makes a difference. Can I ask Adrian or Eric if they have any additional suggestions for or specific language that parents can use?
Sure, that's a really great question. I would say definitely echo everything that Olivia said about making listening kind of the first goal. But keep in mind that it's really normal and natural for kids to want to protect their parents. Your teenagers may not want to worry you and they don't want to disappoint you. So if they're not sharing information, that's also okay. In the absence of information, it can still be helpful to bring up therapy as an option. And depending on what's going on, depending on how worried you are, depending on what signs and symptoms you're seeing, there is a place to say, hey, I'd really just like you to try therapy. So for example, you can say something like, I'd like you to try therapy for a few sessions. I don't need to know what happens in therapy. You can choose what you talk about. You can choose whether you talk. You can choose what the goals are in therapy, but I need you to give it a try. Just like if your child was showing a pretty big change in their cough or their sputum production, you would take them to CF clinic, and it's not really optional. And so there are times where if you're really worried, you can ask your child to just give therapy a try. And there's a place for that, but I would reach out to your care team if you have specific concerns, and they can help you navigate that conversation. And they can also help you figure out if it's okay to wait and watch, or if it's time to just say, hey, let's give therapy a go.
Okay. Did you have anything to add, Eric?
Just to help demystify therapy, share any stories about anyone else who's had therapy. I really like just giving it a try, as far as, give it a couple of tries and see what happens. And it really is just a place to talk. Some people think we lay people on a couch and we take notes the whole time they're talking, and that's not really what happens. It's really just an exchange. Sometimes if you offer to go with them, I'll go with you for the first time and then step out of the room. That might also be something, depending on, your relationship and how you guys are talking about therapy in general.
Okay. I have another question that actually I can ask you, Eric, and that is, how can I be sure I won't scare my child off by bringing up my concerns?
Well, I like how a lot of the panelists have talked about just trying to demystify mental health from physical health, is likening it to something physically, like your cough. I've noticed your cough is worse, or I've noticed you're up, not sleeping as well. Mental health, everything's connected here. We're not separate. So our heads are connected to our bodies, and it's just one part that we need to take care of as well. And if we take care of our mental health, our physical health is better. And that way we can do some of the things we like to do and not have to miss out on the activities that we typically like to do. But that mental health has come a long way, and it's something that can be helpful for somebody who doesn't have a debilitating mental illness. It's just, let me just go sort some things out. Sometimes even pitching it as, this could be just short term. Maybe you go for 3 to 6 times and we're okay, and then in a couple of years, if you want to go try it again, you can try it again. So, being supportive and talking about it in a way that helps a child understand that there isn't a stigma, other people have done it. It's helped maybe mom or dad or whatever, your younger brother or cousin. And just, if you're nervous, it's normal to be nervous because you've never done this before. You're going to be nervous. That's a natural thing.
Yep, I can see that. Olivia, did you want to say something to that?
Yeah, I just wanted to give a little personal anecdote related to what Eric was saying. My parents individually saw therapists, in their early 20s and 30s, and regularly mentioned things that they learned in therapy as I was growing up. And then were also open about the fact that they went to see a marriage counselor at some point in their marriage. And knowing these things and hearing stories from them about how helpful their therapist was really made me feel like, oh yeah, it's totally normal to go see a therapist, and is probably a really awesome and helpful thing to do. So when I needed it, I was willing. And I think it does have to be, I was ready for it, because there was another time when I was like 13 that my mom asked me to go to therapy, and I tried one session and I just didn't really like it or need it at the time. So I stopped going. And that didn't stop me from trying again in the future. So I just think if you have had any experience with seeing a mental health provider, maybe share that information with your kids. I don't know, could end up making them more open to it.
That's a very good point, Olivia, that talking, if it's normal for your parents, then it becomes something that you will consider. And I did that myself as a parent. I took therapy, and then, it was easier for me to share that with the rest of the family, and not just my son with CF, but my non-CFer also. And so, yeah, I find that, taking that stigma and breaking the stigma is probably a great way to go. So thank you for that, Olivia. Did you have anything to add, Adrian, on that question?
I think, the question was, how can I be sure I'm not going to scare my child by bringing this up? And I think the important answer here is, like, sure, they might be uncomfortable and you might be uncomfortable, but sometimes uncomfortable conversations are just worth having because your child is important and we can't be comfortable all of the time. So if you're uncomfortable, you are doing it right.
Very good. So the next question I have is, how can I tell if my child is at risk of harming themselves? And I think while I have you on, Adrian, maybe you and Eric can help answer that one.
Yeah, thank you for the question. I'll say, in terms of talking to your child about self-harm or thoughts of suicide, some people think that bringing those ideas up will make your child more likely to take steps to hurt themselves. And there's no data to show that that's the case. There's lots of data showing that if you don't ask, you miss the chance to intervene. So don't be afraid to ask your child if they've had thoughts of harming themselves or thoughts of wanting to end their life. If it is a hard thing to ask, but it is an important thing to ask and worth asking if you're noticing the other warning signs. So if you believe your child intends to hurt themselves, take it very seriously. If you can't keep them safe or don't know how to keep them safe, then go to the nearest emergency room or call a suicide hotline and they can walk you through the steps about what to expect. Here are some warning signs to look out for. You may have heard these already, but really like talking, writing, or joking about death or suicide is something to look for. Pay attention to any signs that your child feels very hopeless and very helpless to solve their own challenges, because when people perceive that their problems can't be solved, that's when they start to consider suicide. Look for really significant changes in how much they're interacting with friends or family versus withdrawing. You can look for impulsive or aggressive behavior, which very aggressive behavior is also a risk factor for suicide. A recent history of cutting or other self-injury within the past year is a risk factor, and then significant bullying, trauma, or abuse. But the important thing is to follow your instinct as a caregiver. You know your child's baseline, you know what they're usually like, so look for changes. And then any parent of a teenager can just take some precautions just in case your child has a really bad day by removing access to means. So just make the house safe as a precaution. That means things like limiting the amount of Tylenol in the home, because Tylenol has a really narrow margin of safety. So limiting the amount of Tylenol in the home, locking up the Tylenol and Advil that you do have, limiting access to other medications. Fortunately, most CF medications are very bad candidates for an intentional overdose. But talk to your care team about your specific concerns, because there might be medications for co-occurring conditions like insomnia or depression that could be used to overdose. Limit access to alcohol, because kids make bad decisions and humans make bad decisions when they drink alcohol. And then if you have a gun in the home, consider whether you really need it to be stored at home or whether it can be stored safely outside of the home. And if you feel that you need to have a gun in the home, separate safes, one safe for the gun, one safe for the ammunition, different combinations on the safes that can't be guessed by your child. You don't want to use like birthdays, addresses, parts of phone numbers, because kids can hack these safes all the time. And it's a tough topic, but 61% of gun deaths in the US are from suicide. So really limiting access to guns is a big thing. So try to make your home safe with common sense precautions, and definitely read more in the chat. There are some other really great websites and resources on what to look out for. So thank you for the question.
Thank you. Eric, did you have anything to add to that one?
No, that was very thorough. I would certainly say the same thing to many of the families that I work with too. Thank you.
Perfect. Okay. And let me see, there are another couple of questions. The first question that came in relates to Trikafta. Eric, is Trikafta associated with mental health side effects?
So I can just speak in general in my clinic. We have had 2 or 3 children out of our clinic has 180, and of course not all are taking Trikafta. We've had about 2 or 3 children that have presented with some symptoms that could be attributed to Trikafta. And really, I can't say whether or not that there is a true correlation. There is not enough data to support that, but there have been some brief anecdotal reports about Trikafta increasing insomnia, increasing depression or anxiety, presenting children who without a history of psychosis with psychosis. So I would say, just like we've all been saying, if you feel like your child is not the same, please bring it up to your pulmonologist, and the pulmonologist will address that with you, whether or not the benefits outweigh the risks or the risks outweigh the benefits, and continuing taking that medication or not. So there's really not enough information right now to give you a definitive answer.
Okay, thank you for that. The next question that I have is for Adrian. Here's a question I'd like to pose to you first, and then we can hear from Olivia and Eric. And that question is, what advice do you have for a parent whose child has started therapy, but is concerned about taking medication?
That is a really great question. I would say the answer is it depends, because taking medication is a personal decision that you and your child get to make with their mental health provider. There are many benefits of medication. So the data all show that medication generally helps people get better faster, and therapy helps people stay better longer. And so they work really well in tandem. If somebody is interested in trying both, they each can help each other. The medication can make the therapy more effective, and the therapy can help the medication work better. At the same time, it is a personal decision. And so I would say, as a family who's been living with CF, you are in a great position to help your child explore the risks and benefits of starting the medication and the risks and benefits of not starting it. So that's how I would answer that question.
Yeah, I would chime in with kind of similarly. I think it's a very personal decision. I know that when I was going to therapy and when my therapist suggested that I start some antidepressants, it actually took me a few months to kind of warm up to the idea. And a lot of that was just due to my to the stigma that I had, that I think is very present in our society about taking antidepressants and mental health medication in general. From my personal experience, those concerns of mine were pretty unfounded. As soon as I started taking the medication and as soon as it started having its positive effects, I was really grateful that I had done it and had the support from my therapist and encouragement to try it, and also support from my family in my decision to do it. And the other good thing was that my therapist and my family were totally fine with my decision either way. The first time my therapist brought it up, I was like, oh, I'm not really ready. And she was like, that's totally fine. I kept seeing her, and she never pushed it on me. And I eventually came around, and I'm glad I did. Also, that may not be for everyone, just my experience.
It's very, very helpful to hear your experience. And family support for you seems to have been really helpful. So that's a great thing. Okay, I have another question. This one here is for you, Eric. What can parents do if their child is being treated differently by friends because they have CF?
Well, as we've stated, trying to just validate and normalize some of their feelings around it. Again, if we jump into trying to fix it, or, maybe they just, this or that, they don't really understand, really take them serious and listen to them. And I would ask them for specific information that kids are saying or teenagers are saying to them. Sometimes we can help the child learn different ways to respond to different things. And a lot of times these questions or bullying or picking on come from a place of misunderstanding. And people really, if something might intimidate them or make them afraid, they may be more inclined to misinterpret or make fun of it. And really that's just a coping mechanism for people when they get to be kind of nervous or not really sure what this is. Helping the child to learn if they want to help their friends understand what that is, and setting something up with the other parents where they want to explain that, or how do you want to handle it? Do you want to just kind of learn how to take it and go on with the other, or do you want to really help them understand? It could be a teachable moment for their friends, but really making sure that they are heard, first of all, and not to minimize it. And even if it's something small about going to the office and taking medicine, that's a big deal for sometimes, or kids. So I think an open conversation and then problem solving of what do they want to do about it. They might not want to do anything. They might just want to be heard, and that's okay too.
Very good. And following on from that, there's a question that actually would relate to you, Eric, again. We have a parent that's asking for advice if they can't find a therapist in their area. What kind of advice would you give them?
So if they can't find a therapist in their area, one of the things that the pandemic has afforded us, and I don't know how long it will be, is as long as we're under the health emergency, that person can see anybody that's licensed in their state. So if they reside in an area that's more rural, or they don't have very many practitioners, they can open that search up to other licensed professionals in the state. The other thing is make sure that they're looking for not only a psychologist or a social worker, but there are mental health counselors and licensed marriage and family therapists. I know there's a lot of different letters behind our name, but we all essentially will be able to afford the same type of therapy. So the other thing that you would want to keep in mind is if there is anyone at the care center, they may already have a referral list or a network of places that they can refer. The other thing is that if somebody wants to work with kids and they've got experience with chronic illness, but not really about CF because it is so unique, I've called therapists and given them a CF 101 just to kind of give them an idea of what CF is, what are the typical presentations, how it might affect mental health, what are some things to be aware of. And that seemed to be helpful in basically training therapists to know a little bit more about CF so that they're more comfortable working with kids or families with CF.
Very good. I have one more question that just came in, and this one, Adrian, I'd love to hear from you on this next question. Are some kids more at risk for mental health issues than others?
That is a great question. And the answer is yes, some kids are more at risk, but just being at risk doesn't mean that you for sure will have a mental health condition. It just means you're at risk. So the kids who are at increased risk are kids who have a family history of any kind of mental health condition, kids who have experienced significant trauma, abuse, neglect, being involved in the foster care system, very significant bullying or social exclusion, and then kids who belong to communities that experience stigma or marginalization. So for example, adolescents who are people of color, adolescents who are LGBT, all of those communities experience elevated rates of depression and anxiety that has been linked directly back to the discrimination faced by those communities. But the really important thing here to know is that there's a lot of data about the protective role of close family relationships or close relationships with any caring adult or peer, and how that can really protect against the negative effects of discrimination and stigma. So for example, kids who identify as transgender, if they come out to their parents and feel accepted and supported, they are significantly less likely to be depressed and significantly less likely to try to end their lives than kids who feel rejected by their parents when they come out. And that's just a really great example of how parenting and having supportive relationships can buffer against these other stressors.
Okay. Thank you for that. Thank you for all those answers. We're almost out of time. So I'd like to close with one last question for all of the panelists. Adrian, Eric, and Olivia, thank you so much for everything you've shared tonight. I'm sure everybody that's tuned in is really enjoying what you have to share with us. I know that so many parents are feeling overwhelmed right now. If you could share just one piece of advice for people to take away tonight, what would it be? Let's start with Olivia.
Sure. I think, one big thing I would love people to take away from today's event is just to not let the stigma and stereotypes and bad feelings that our society has in general about mental health medication, to not let that prevent you from seeking help if you need it. I think it can be really effective for certain people, and it certainly helped me. So I'd like to encourage people to use resources that they have, and therapy and medication if they need.
So break the stigma and ask for help. That's a good one. How about Adrian?
I'd like to share just with everyone that depression and anxiety are so common that we know how to treat them. So effective treatments are out there and are widely available. And if you have concerns, then you can get treatment.
Very good. And then Eric?
I'd just like to remind every parent and caregiver out there that you're really the expert when it comes to your child and your teen, and trust your gut. If you have a feeling that something isn't right, that's probably true, and go with your gut. Mention it to a professional, mention it to your pulmonologist, mention it to anybody in the clinic staff. It's better to have it checked out and there might not be any really thing that needs to be medically addressed than really just to ignore it or assume that, this is just a phase, they're an adolescent. If you really feel in your gut that something's wrong, please mention it to somebody.
Very useful advice. Thank you, Eric. Thank you so much, Olivia, Eric, Adrian. Those were great answers to those questions. As a parent, I'd like to add, just stick with it. Just don't give up. And things will get better if you don't give up. So I would definitely add that one. But unfortunately, that's all we have time for tonight. Just a reminder that this will be posted on YouTube for those who missed it, or if you'd like to refer back to any part of the conversation. We'll also include a list of resources that were mentioned during our discussion in a follow-up email with the recording. So thank you so much again, Olivia, for sharing your experience. Adrian and Eric, we are so grateful for the education and insights about how to help our kids flourish emotionally. And especially thank you so much to everyone that tuned in, and have a great night.